So today we will talk about Swiss health insurances. So there should be just a short overview of the two different versions of health insurances which exist in Switzerland, and to explain where is the difference between these two different parts of health insurances. So the first one we should know, the first one you need is a basic health insurance, which is added, or to which we normally add a second insurance, which is called the complementary health insurance. So where's the difference between these two insurances? Let's start with the first and probably most important point. The basic health insurance is compulsory in Switzerland. So if you are living in Switzerland, if you have a permanent residency in Switzerland, you are obliged to have such a basic health insurance. So if you work in Switzerland, you have to have a basic health insurance, or if you live in Switzerland, you have to have a basic health insurance. The complementary health insurance is voluntary. You are obliged to have one, but sometimes it could be quite a good idea to have this complementary health insurance. The second difference is there are standardized benefits for the basic health insurance, and there are quite a lot of different benefits and different services for the complementary health insurance. It depends on the insurer you choose. The next difference is the basic health insurance is based on Krankenversicherungsgesetz, KVG, and the complementary health insurance is based on Versicherungsvertragsgesetz, VVG. And the next, and probably also quite an important difference, is there is the admission to the basic health insurance is obligatory. So the insurer has to take your offer, has to access you to his insurance. He's not allowed to say to you that you are not admitted to the insurance. But the complementary health insurance, there's no admission obligation. It's up to the insurer if he takes the contract, if he takes you as a contract partner, or if he doesn't admit you to the insurance. The next thing we have to talk about if we look at Swiss health insurance is the franchise, or let's call it franchise in English, but as we are in Switzerland, a lot of Swiss are talking French, so normally you call it franchise. And deductible. The franchise is a fixed annual fee which each adult, but just the adult, no children, must pay as a contribution to their own treatment costs. This is fixed, but it can be increased voluntarily, which will have an impact on your premium. And the second one is additionally an Selbstbehalt, or a deductible in English. It's the share which you have to pay on the medical costs and the medication costs, and each insured person has to pay this percentage. Normally this is 10%. In Switzerland it is 10% of each invoice on medical consultants or on medication costs. And what is quite good, this amount is capped annually. There's a maximum which you can have a year, which you have to buy, which you have to pay on deductibles. But let's look at it in some simple exercises. We have here two exercises of invoices you receive, and we try to find out how high is the obligatory franchise and the deductible. So, first of all, the total physician and physician consultants and medication costs were 1,200 Swiss francs. So, what happens? How much has the patient to pay? What is the payload? The first one to think about it is the obligatory franchise, which we set to 300 Swiss francs. It is possible to set it up to 2,000 Swiss francs, but in this case we just say that's the minimum, which is 300 Swiss francs. So if we pay this 300 franchise, the remaining amount of the first invoice is 900 Swiss francs. So on this 900 Swiss francs, we have to pay the deductible of 10%. So 10% of 900 Swiss francs is 90 Swiss francs. So how much of this invoice does the health insurance pay? The rest to this whole invoice, which is 810 Swiss francs. So next exercise, we have total physician and medication costs of 20,000 Swiss francs. But it stays the same if it's just this invoice in a year. It's a new situation. We also would have had to pay 300 Swiss francs obligatory franchise. So 19,700 Swiss francs remain. And we have to pay again a deductible of 10% from the remaining invoice of 19,700 Swiss francs, which would have been 1,970 Swiss francs, but the maximum deductible is just 700 Swiss francs. So we just have to pay the 700 Swiss francs. So how much does the insurance company cover? It covers 19,000 Swiss francs. So I hope this shows you what is the difference between franchise and deductible. We see us again for the next topic. Goodbye.